Today for South Africa, the first of our country's teenagers who are taking part in a global COVID-19 vaccine trial received their jab this morning. Some 2,000 children aged from 6 months up to 17 years will be taking part. They are receiving the Sinovac and Pneumolux jabs. Bateman was at the Sefako Makgatho Health Sciences University in Pretoria today. He joins us now. So a big moment. Quite a few countries are involved. Just tell us a little bit more about how it's all going to work and how many children have already received this vaccination safely in China.
Good afternoon, Sally. Well, there are 5 countries taking part in the trial. South Africa, of course. We saw that historic moment today of those 2 teenagers getting their jab. But, of course, another African country, Kenya, is taking part. And we've got Indonesia and Malaysia, as well as Chile in South America that will be participating in this. 14,000 in total, 2,000 in South Africa will be getting the jab. There will be 1,000 of them getting the actual Sinovac, another 1,000 that will be getting a placebo. And this will take place over the next couple of months. Obviously a significant step in the move towards trying to fight COVID-19. We had Dr. Glenda Gray from the Medical Research Council who joined the event today by Zoom. She's also a pediatrician, if you didn't know that, Sally. And she was saying she's putting on both hats, the pediatrician and the Medical Research Council, throwing her support behind this initiative, saying that often children have largely been ignored in the research related to vaccination. So she's very excited about this particular aspect of research and certainly getting her full support.
And of course, the big question is one of safety. And while we know that it wouldn't have even got this far if it wasn't safe, it's obviously something that has to be addressed and has to be very transparent. So how do we know that this vaccine is safe for these children receiving it?
Yeah, very important question, Sally. We're dealing with our children here. And whenever it comes to children, we're always going to ask those questions. You know, what about their safety? And vaccination of children with the for the coronavirus is also a very hot and topical issue, a very controversial issue. So start off by saying that already 15 countries have approved the Sinovac vaccine for administration to adults. It has gone through the various rigorous research trials before. It has been published in the Lancet Journal, for example. So it has been approved and is being used by 50 countries around the world. So for it to get to this stage, it has gone through rigorous testings, but then locally it would be monitored very closely by the relative authorities. And we had this project coordinator who was present at the briefing today, and she had this to say.
Sinovac is a safe vaccine. We've heard this now from several people talking about the Coronavac vaccine. It's safe and it induces humoral immunity. The vaccine has been tested in phase 3 trials in adults in Brazil, in Chile, in Indonesia and in the Philippines, and it has also been shown to be very effective in these studies, ranging from 51% in a healthcare population to 93% in the Turkey and Indonesia population and 87% in Chile. The vaccine has actually received emergency use approval in our country as well, and that happened on the 1st of July. And Coronavac has also been registered emergency use approval and have received full registration in some countries now and is available in almost 50 countries. So it is a safe vaccine. We know that we've got good data in adults, and the phase 1, phase 2 study have been concluded in China. The results have been published in the Lancet on the 14th of June this year. And the vaccine has actually also been rolled out, as we've heard from Sinovac this morning from the Research and Development Department. It has been rolled out into China already in children aged 3 to 17 years.
Yeah, and I think that's important to remember that I think it's between 40 and 60 million doses of this particular vaccine have already been given to children in China. So talk to me about the time frame for this trial. So it started in China. The phase 3 trial, which is I think what we're on now, is rolling out. What happens after this?
Well, first off, Sally, the children the cohort here that we're dealing with from 6 months to 17 years old are going to receive 2 jabs, spaced or 1 month apart. I suppose very much similar to the Pfizer jab, if you've got that already. And they will be monitored for an entire year or 12 months from the second jab. No indication at this stage, when it's going to get to a point of approval, or, there's a significantly rigorous process that the scientists still need to go through here and study the effectiveness. But it also speaks to that safety. The people that are going to be given this vaccine are going to be watched very closely for at least a 13-month period to ensure that there's no adverse effects and to, of course, check the efficacy of this particular vaccine.